is working well. So I'm just going to talk a little bit about our workshop and what we're doing here. And that's every second Saturday, right, Brother Taf?
Third Saturday.
Okay. Okay. And remind that. And then I'm going to read your bio and then you can take it away. And once you're done with, I think we see for your attendings and I don't know how you would want to do it. My only suggestion is sometimes leaving time so people can ask questions would be a nice way to do it.
Sure. Yep, I can leave time to do that, inshallah.
And we share them the contact details so that they can get back with the questions. And they don't need to send it to the NMCC, but to you, because we don't want to address and forward this.
Yeah, sounds good. And I have PowerPoint slides and I can also share them with whoever wants to see them.
Yeah, and actually my daughter is in Girl Scouts and she's trying to kind of do something for Silver Award. And I was suggesting she do a mental health sort of a blog or something for Muslim community in Austin. And maybe she can put a lot of resources, put all your power slides and all that we're doing, like that on that, and we can link that to maybe an MCC, Brother Altaf.
Yeah, of course, we can do the entire series. She can create her own blog if she wants, and
Yeah.
then we basically link it from the series link,
Okay,
and
and
people can go and get all the resources.
you wanted to do something similar, right? Um, kind of create those resources. So
Yeah.
I may bounce it off to you, to supervisor.
Yeah, sure, no problem. I would love to do that, inshallah.
That'd
Oh,
be
I'm
good.
so sorry, my camera was on, but I had a shutter on. So
Oh, no worries.
and we'll give like few minutes for the people to join in. We get some, give them some time to join in, and then inshallah make a dua, and then we can continue.
Sounds good.
Okay, Assalamualaikum. In the interest of everyone, we just going to give a few more minutes for everyone to join, inshallah, and then start. So, a few more minutes, inshallah. Okay, sister, inshallah, we can start and make a dua, inshallah, and hand it over to you. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين اللهم صل على سيدنا مولانا محمد وعلى آله سيدنا مولانا محمد وبارك وسلم بسم الله. Yeah, sister, please go ahead.
Assalamualaikum, everybody. We have Sister Najeeha Khan here. She's going to talk to us a little bit about helping your loved ones during emotional distress, what to say and what not to say. This is part of the mental health awareness series that we're trying to do, creating more education for our Muslim community. This happens every third Saturday of the month. We've got a couple of things lined up, and Sister Najeeha has been gracious to sign up twice on that. So we really appreciate her time. This is also getting recorded, and Sister Najeeha is also going to leave her contact information if you have any questions to talk about after this session. So I'm going to start off by introducing Sister Najeeha here, and then she'll take over. Najeeha Khan is a MS LPC Associate, received her master's in counseling psychology from University of Wisconsin-Madison. She's recently moved to Austin, Texas in summer 2020. So welcome to Austin. She had experience working with survivors of trauma, racial ethnic identity development, anxiety, depression, life transitions, college students, career exploration, and more. Currently, Najeeha is working with Austin Counseling and Nutrition, where she provides psychotherapy to a diverse range of folks. Najeeha specializes in disordered eating, body image concerns, self-esteem, ethnic minorities, mood disorders, and general life stresses. She also integrates Islamic ideologies of healing into sessions with Muslim clients and aims to focus on client relationship with themselves, with others, and their environment. This is sort of a rare commodity in Austin because I get a lot of requests for Muslim counselors. So I really appreciate you moving to Austin and wanting to help out our community. Thank you very much for that, Najeeha, and thank you very much for giving your time today. So I'll let you start. I'm going to actually mute myself and off my camera. If there's anything, just text me, call out, and I'll be there.
Sounds good. Thank you so much, Dr. Khan, for the warm welcome and introduction. Assalamualaikum, everyone. Bismillah. Yes, so I'm going to be talking today about how to help your loved ones during times of emotional distress, or if you have a friend or family member who approaches you and they want to talk to you about a mental health concern that they've been having. I think a lot of us have either had somebody approach us and want to talk about this, or we ourselves have gone to someone to talk about these issues, and maybe we didn't hear what we needed to hear, or it wasn't very helpful, or we didn't know what to say. And so hopefully, inshallah, this talk will help give some pointers. The statistic is 1 in 5 people, so that's at least one person in every average family size, has a mental health concern. So that means that we all either have a mental health concern ourselves, or somebody very, very close to us does. So that's why it's important to know how to talk to people, what to say, what not to say, and how to really listen to people. So I have some PowerPoint slides, and inshallah, I can send the slides out to whoever wants to see it. So let me just share my screen. Oh, I don't think I can share my screen.
Inshallah, I will make you the host, and then I think you should be able to do that.
Okay.
Okay, go for it.
Okay. Okay, can everyone see that?
Yes.
Great. Okay. Yes, so again, I'm going to just be talking about ways to identify distress in your loved ones, again, what to say, what not to say, and how to listen to them. We may be the first point of contact that one of our loved ones has when seeking help, or we might be the only person that they're talking to when they want to seek help. Only half of people with mental illness end up getting professional help, and that statistic is actually smaller for Muslim populations. So that's why it's important to know sort of how to handle these situations. Okay, so I wanted to provide a quick content warning before I go into this, just because I know some of these topics can be sensitive or upsetting for some people, just because we all come from different experiences and we've had different backgrounds with this stuff. So really quickly, topics I will be discussing is how to help your loved ones when they're talking about general mental health concerns, but also suicide, self-harm, mental trauma, and panic and anxiety attacks. So please take care of yourself. If you need to leave the meeting at any point, that's totally okay. And on the bottom right-hand corner, I've written what slide is coming up next so that you can prepare yourself if you need to. All right, so part of being able to help somebody during mental distress is being someone that they consider safe talking to. So how can you be someone that will make others feel safe? One way is to make proper terminology a habit. And so I've just included some things that we are mindful of in the counseling field. So here's some examples. Instead of saying depressed person, we say person with depression or a person struggling with mental illness. That way, the depression isn't something that defines their whole identity. We don't like saying committing suicide. We say dying by suicide or death by suicide. And we avoid saying things like crazy or unhinged or psychotic. And a big one also is to avoid diagnosing yourself or other people, even if it's a joke. So I've included some examples of things that I hear commonly in the media. So like saying, oh, you know, people have mood swings, so they must be bipolar, or that person must be delusional, or saying somebody has an eating disorder because they look skinny to you. So this, you know, this stuff may seem harmless and it may even make the people around you laugh. But it's important to be mindful of this, because what you're doing on a subconscious level is you're telling the people around you that you might not be taking this seriously, or you might not have knowledge about this. And so we want to be mindful of how we're talking about mental health so that others know that we're a safe person to talk about it if they ever need to talk about it with us. All right, so now moving into identifying signs of distress. This is by no means going to be an exhaustive list. Mental health looks completely different person to person, and I've yet to meet somebody that fits the exact textbook definition of a mental illness. So these are just some common ways mental health concerns can manifest in people. And so since this is your loved one, you probably know them best. And so these are things you can look out for in them. So one common one is isolation. They might start isolating themselves, not hanging out with friends or family, not talking to people much anymore, not doing things that they usually enjoy. Their eating, sleeping patterns might start to look different. So that could mean that they're eating or sleeping too much, or that they're eating or sleeping too little. Changes in personal hygiene. This one's very common. They might not be bathing as much, brushing their teeth as much as they used to. They could have an exaggerated response to irritation or stress. So this could be like maybe something happened that you consider very small, like somebody cuts them off when they're driving, and you think that's not a big deal, but they're upset about it for a while. Usually that means that there's something else going on and that they're dealing with other stuff in their head right now. This next one is really common, I think, in Muslim communities, but complaining about physical issues that don't seem to have a medical cause. So maybe they start complaining a lot about constant headaches, but there's nothing medical going on. They might start complaining about frequent tummy aches or having trouble breathing, things like that. And I think this is because for a lot of us, we feel the physical symptoms of mental illness before we feel the mental symptoms of mental illness. And so they may not even realize that they're feeling sad or anxious. All they might notice is that my tummy's just been hurting. So if they're complaining a lot about these things, that could clue you in that something's going on. They could be tired a lot. You could notice them sighing a lot or just having trouble breathing. You might notice impulsivity, making decisions they wouldn't normally make, concentration or focus issues, excessive crying. So they might have really red or puffy eyes. They could be constantly getting into arguments with people around them, with you. There could be sudden weight gain or weight loss. And there could also be an excessive use of drugs or alcohol, or just other addictive behaviors. And usually people do that to cope with the mental health concern that they're having. I put a little disclaimer on here. I think it goes without being said to try to not diagnose your loved ones. So if you are noticing these things, it's not helpful for you to be like, hey, I noticed that you've been crying a lot. You must have depression or something like that. That's not usually what people want to hear. But it is, if you have noticed it and it's something that is concerning to you, definitely you can bring it up in a way that's sensitive and doesn't feel like you're calling them out or making them uncomfortable. So you could say, hey, we used to talk on the phone every day, and I just noticed that we haven't been talking as much lately. Is everything okay? Or I'm a little bit worried. You can say it in a way that doesn't feel like it's putting them on the spot and lets them know that you do care about them. All right, things that they might say when they're in mental distress. I always say this to people, but how someone talks to you is likely how they're talking to themselves. So if they've started saying really mean things to other people, to you a lot, if they've started really saying offensive things, chances are that's how they're talking to themselves. And that gives you a clue as to what kind of negative thoughts they're having in their head. So if they're constantly being, kind of rude to the people around them, that might clue you in that something's going on for them, especially if that's not how they used to interact with people. They could start repeatedly making jokes about something that you think is kind of serious, but they're like making light of the situation. Humor is a very common and sometimes very effective coping mechanism for mental distress. One common way that I see humor being a coping mechanism is constant self-deprecation. So I think we all do this. We all use self-deprecating humor to make others laugh. It's better than making fun of other people to make others laugh. But if somebody's doing this repeatedly and the jokes seem like they're getting a little bit more and more serious and you're like, this is actually making me uncomfortable, then that's a clue that maybe they're actually coping with something deeper going on. They could repeatedly bring up a stressful topic and you might be like, didn't we talk about this already? They keep bringing this up. I wonder what's going on. Probably because this is on their mind. Or they might not say anything at all. That's also very common. There might be one specific topic that they just don't want to talk about at all. And I have a little note here on the bottom that people tell you what's really bothering them, and it's important for us to learn to listen to the meaning underneath those surface level words. And I will talk about that a little bit more too. All right, so let's say now somebody wants your help. How are some different ways that they might ask for help? One common way is just noting that they haven't been feeling like themselves lately. That could mean so many different things, and it might feel difficult for them to verbalize how exactly they have been feeling. They could also make comments like, I wish things weren't so hard right now, or saying something like, what's the point of fill in the blank? What's the point of life? What's the point of going to work? What's the point of getting married? Blah, blah, blah. You could really fill in the blank with anything. So they could be making comments like that. They could also write out, say, I've just been so stressed and overwhelmed lately. I've noticed that that's usually a lot easier for people to say than I've been very sad or very anxious lately. So saying things like I've been very stressed, it's been difficult to relax lately. Those are all ways to ask for help. And they might also give vague responses when you ask them, how are you doing? They might say things like, I'm just surviving, or I'm hanging in there. So those are kind of vague responses. And since we're taught to say, I'm doing well, when they don't say that, that can tell you that something else might be going on. All right, so I mentioned that it's important to listen to the meaning underneath the surface level words. So that's really part of being an active listener. And so being an active listener is about having a conversation with someone to really have a conversation with them and listen and understand them. Sometimes when we're talking to people, we're kind of preoccupied with what we want to say and say it quickly and make sure that we're heard. But being an active listener is a little bit deeper than that, and making sure you are promoting an actual conversation with that person. So pay attention to what they're saying, but also what they're doing. Listen to their nonverbal cues. So I've included on the side things that you can look for when you're talking to them. This is stuff that I do in counseling with clients, and it's really, really helpful to figure out how somebody really feels about a topic. So you can look for tears in their eyes. Let's say you're talking about the issues that they're having, and then there's one particular thing you say or they say, and then all of a sudden you notice their eyes welling up with tears. That's a pretty good indicator that that's the thing that's bothering them. I also like to look at people's feet, because that's where the fight or flight system usually is visible. So if somebody gets uncomfortable during a conversation and their feet tense up, or they start fidgeting, or they're just sitting at an awkward angle, that's usually pretty telling that they're pretty uncomfortable or something's going on for them. Muscles tensing, their shoulders might hunch a little bit, fists might form, skin flushing. For some people, you might be able to see their neck or their face start to get red when you're talking about something touchy. And they might refrain from giving you eye contact as well. So, and part of also paying attention is to remove your distractions, put away your phone, put away whatever's distracting you, to show them that you are fully present with them. And another way to show them that you're present with them is to give them eye contact, nod, open up your body language to them, lean in when you're speaking to them. That really shows people that you care and you're in it with them. Another good way to do that is to match their emotions. So if they're talking about something sad, you can make a sad face. If they're talking about something angry, make an angry face. If they're talking about something sad, but they're like laughing about it and making a joke about it, you can also try to still make a sad face to show them that you do truly understand what they're talking about. And then respond appropriately. So always pause before speaking and ask yourself, why do I want to say what I'm going to say? Is it about me or is it about them? Don't make assumptions. So you really want to show this person that you're not going to judge them. And making assumptions is going to do the opposite. And so, for example, if they're talking about some distress they're going through, and you say like, oh, you're not, your sleep has been fine, right? Or something that is a leading question. And in reality, maybe they have been having issues with sleep. what that'll end up doing is then they won't feel comfortable talking to you about it later because you already made this assumption about them. And reflect what they say back to them. So give them a summary of what they just described to you. Oh, okay, so you're talking about stress at work. It sounds like you've been really overwhelmed lately. Shows them that you understand what they're saying. And when in doubt, I always just ask more questions. So if you have no idea what to say next, just ask them another question. Get them to keep talking about themselves and opening up more. All right, next. So a big part of being an active listener is being non-judgmental. The number one reason somebody will not talk to a loved one about their mental illness is because they're afraid of judgment. Being judgmental is totally a human thing. We all do it. And the reason we do it is usually because we're protecting ourselves from emotional discomfort. So if somebody says something that we don't like and it made us uncomfortable, kind of to protect ourselves, we immediately start to form judgments. And that can look like anything. That can look like you thinking, I think that's a little weird for them to say something like that, or I don't understand how they can be sad if they've had all these privileges, or thinking somebody's being selfish because of the way that they're handling their life concerns. All of those things are passing a value judgment. And so it's important to remember that once you start having those judgments, that you stop yourself right there and not let it be known that you're judging them. So monitor your facial expressions, your tone of voice, all of that stuff can convey your judgment. And one way to stop feeling judgmental is to remind yourself that not a lot of mental illness is in people's control. It can be a chemical imbalance in their brain that they have no control over. It can be a normal reaction to a stressful situation. And mental illness, really what it is our brain's way of telling us that something is wrong and then coping with it. So you may not like how they're coping with it, but the reality is that they are coping with it. And their mental illness is helping them in a way, maybe you don't understand how, but it is helping them survive. So that's why it's important not to judge them, because they may have fallen into addiction, they may have so much going on, but all that is helping them cope. And so your job is to listen and to provide support and not make them feel bad about what they're going through. Being neutral, this one is really interesting. So obviously we don't want to be negative when we're talking to people, but we also don't really want to be positive either. So what I mean by that is, let's say somebody tells you something that they're dealing with, and you kind of feel an instinct to look on the bright side or help cheer them up in the moment. That's not usually helpful for people, because it can kind of make them feel like, oh, did they really hear what I just said? Like I'm describing something kind of difficult and they're trying to make light of the situation. One example is, let's say somebody tells you that I've noticed I've been sleeping a lot lately, and you want to say like, oh, let me help them feel better so I can make light of the situation. And I say something like, okay, well, I'm glad you're getting a lot of rest, or I'm glad you're able to sleep in. You must be tired, or something like that. But you don't know what the reality could be. For them, they could be sleeping in so much that they're missing work, that they're not able to get their regular tasks done throughout the day. And so it's important for you to remain neutral. Instead, you can just ask a neutral question like, why do you think that is? Or what's going on for you that is making you sleep more? What do you think is happening? Again, when in doubt, ask more questions. That goes into being curious. Having a curious attitude really helps with maintaining that neutrality as well. And just important to know, imagine being in their shoes and having to share something really vulnerable and sensitive with somebody. Most people don't have fun when they're talking about really vulnerable things, even if it's someone you really, really trust. So just have empathy that it's going to be it might be really, really hard for them to talk to you about this. Okay, what not to say. I just sort of compiled some common things that I think people struggle with when somebody's talking to them about mental illness. These are all things that human nature pulls us to say, and I'll talk a little bit about why it's usually not helpful. So the first is bringing attention onto yourself. This can be helpful if you're describing going through a similar experience and letting them know that you know how they feel. But what it can have the potential of doing is making them feel like you're taking the attention onto yourself and you're not really paying attention to what they're saying. The fact of the matter is, you're not in their shoes, you haven't grown up in their environments, you probably don't really know what it's like for them to be experiencing what they're experiencing. Maybe you've also had that mental health concern, but it was probably much different for you than it will be for anybody else. And so it's, it's okay to be like, I understand why you're stressed. I felt like that too when I went through this, but that's really where it should stop. And you should help them get the attention back on themselves so they feel comfortable to keep talking. This is a big one. Don't bring up religion unless they explicitly say that they want to talk about it. So a lot of times we feel the need to say things like, oh, you've been feeling sad lately. Have you thought about praying more? You're going through this tough time. Have you thought about turning to the Quran for answers or making this dua? Yes, hands down, it's always a good idea to pray more and to read Quran more and make more dua. Of course, those are great things to do. But that person probably already knows that these are things that they want to be doing more of, and they might be feeling guilty about it. So to bring it up to them can feel dismissing, it can feel shaming. And also, one huge thing to remember is that our mental illness doesn't necessarily mean that we don't have a good relationship with God. It doesn't mean that we're weak in our iman. Like I said before, a lot of times mental illness is not in our control. And so that's why it's not really helpful to bring up religion. And it's especially not helpful to try to tell them that something is haram or unlawful. For example, if they're like, I've been drinking alcohol because I've just been so anxious and it's helping me, or something like that. And you tell them, oh, don't you know alcohol is haram? They probably do know that, and they're not coming to you for religious advice. They're coming to you for emotional support. And so trying to convince them that something's haram and to get them to stop, it's not going to help them. It might actually make things worse. So it's important to refrain from going there. Again, if they're the ones that bring it up first and they want to talk to you about it, then go for it and talk to them about it in a gentle way. A lot of us feel the need to remind people of the blessings or things they have to be thankful of. You have a loving family. Some people are all alone and they're going through what you're going through. So saying things like that sometimes makes people feel worse about what they're going through, because they might feel like, oh, you're right. Why am I feeling bad then if I have all these good things going for me? And then they feel guilty about the emotions that they're feeling. So that stuff can also feel a little bit dismissing. And I think I mentioned this before, but trying to cheer them up or trying to distract them from their emotions can also not usually be helpful. Feeling difficult emotions is part of the healing process. So if you try to cheer somebody up when they're crying to you about something, it might feel good in the moment. They'll stop crying in the moment, maybe they'll get distracted, and short term it'll have positive effects. But long term, it didn't actually do anything. It's important for people to heal, to be able to feel the painful emotions that they're going through. So instead of trying to cheer them up, a much more beneficial thing to do is to sit with them while they're feeling that difficult thing. Sit with them while they're crying. Hold their hand, hold them, be there with them. All right, last one is, I think the most common thing that everybody wants to do when someone comes to you for help is giving advice. So again, unless they explicitly ask you for advice, they probably don't want your advice. People don't reach out for support because they want solutions to their problems. People reach out for support because they want to know that they're not alone and that someone's with them, because they want your comfort and your warmth. Not because they want you to help them necessarily solve the problem. So you're not obligated to try to solve their problem. The reason that we feel pulled to do that is because if this is your loved one, you feel their pain with them and you want that pain to go away. So that's why you want to give those solutions. But what's going to be more helpful to them is, again, if you sit with them, you listen to what they're saying, and you support them emotionally instead of giving them physical solutions. And also, usually people have tried a bunch of things already And so that's why it's not usually helpful for you to start spewing solutions at them. If they say, hey, can you give me some advice on this? Then you can definitely start giving advice. But first, it's better to ask, okay, sure, what have you already tried? And then they'll tell you what they've already tried. And then you can sit down and brainstorm together. All right, so then what you can say, a simple I'm sorry goes a very long way. It shows them that you have empathy for their situation. Also telling them that you've understood what they're feeling. That sounds really tough, difficult, scary, fill in the blank. Sounds like you're angry or sad or afraid, etc. Let yourself feel those emotions with them. It helps them carry their pain. And it shows them that they're not alone. Asking them how you can help. A lot of times people already know what they want from you. They're just having difficulty saying it. So asking them opens the door. And sometimes they might not know what they need. And in those situations, you can say, it's okay, I'll be here for you no matter what. The most important thing you can do is assure them that it's not going to change the way you view them or your relationship. People worry about that a lot, that if I tell this person what's really going on in my head, they're not going to want to be my friend anymore. So assure them that that's not the case. And silence. Silence is so powerful. Again, just sit with them, give them the room to explore their emotions in silence, and just be there with them. All right, so now I will start talking about suicide and self-harm. So again, I know these topics can be upsetting for some people, so feel free to leave now if you need to. And I suspect this will take a few minutes to talk about, so you can join again later if you need to. And we'll kick it off with self-harm. So self-harm can range from snapping a rubber band on your wrist, to taking a really, really scalding hot shower, to cutting with a knife. It can really be anything. And a lot of times there's no logic here. People are not doing it to necessarily because they're thinking of killing themselves. It might be because of that, and it might be the thing that's preventing them from acting on their suicidal thoughts. But sometimes it has nothing to do with suicide. And sometimes they're just in so much emotional pain that it's their way of releasing. And sometimes they're so numb that it's their way of wanting to feel something. So one really important thing to do here, I think we hear this a lot in the media, but the cry for attention myth, if you all have heard of that, it basically is this idea that people only self-harm because they want attention from others. And I would really encourage everyone to get that thought out of our heads, because even if we were to assume that that's why people are self-harming, let's stop and consider that for a moment. If somebody wants attention, what they actually want is help, or they want some comfort for the emotional pain they're going through. So it's just not helpful to think of this as they're just wanting attention. The reality is they're going through something very, very painful, and this is their way of dealing with it. And self-harm there's so much stigma around it that most people wouldn't want people to know that this is something that they're going through or that they're doing. And so assuming that they're just calling for attention is usually inaccurate. So if you have a loved one that is engaging in self-harm, the most important thing to do is to talk to them and not treat them like they're a criminal for hurting themselves. That guilt can really drive people away from talking about it again. And then ask them if you can help out in any way, help them replace. So like if they're using a knife, can I hide your knife for you? Would you like me to do that? And helping them come up with other activities that they can do when they start to feel overwhelmed. And now we'll go into suicide. So here's some verbal cues that somebody might give that they're actually thinking about killing themselves. They might say, I'm tired of life, I can't go on, people would be better off without me, who cares if I'm dead anyway, wish I could go to sleep and never wake up, pretty soon you won't have to worry about me. Sometimes people give ultimatums, like they'll say, if I don't get into this school, if I don't end up with this person, et cetera, then I'll end up killing myself. So if they're saying these things, it's not necessarily your job to try to understand why they feel this way. This is where it's really important not to judge, because the last thing you'll want is for them to feel uncomfortable around you and stop sharing things with you. If they're sharing this with you, that's really, really great because they're talking to someone about it. And again, it could be for any reason. Sometimes people think about suicide because they want out of their emotional pain. Sometimes it's because they don't even have control. It's their thoughts taking over. So that's why this is another place where it's important not to start preaching at them that it's haram or it's wrong or immoral. It's important to listen and encourage them to seek out professional help. Here are some physical cues of what they might start doing if they're seriously considering suicide. They might start arranging for people to look after their assets, their kids, pets, might start isolating themselves and neglecting responsibilities. So might stop showing up to work or school. Or they might even start doing research on how to kill themselves and collecting the necessary materials. Not everyone's going to write a letter like they show in the movies and be clear about their intentions. Sometimes you won't even know that somebody was thinking about this. So again, it's important to get a mental health professional involved here. So if somebody in your life starts talking to you about this stuff and you've got your red flags going off and you're like, oh, they might be thinking about suicide, here's how you can ask the right questions. So ask them directly. If you try to beat around the bush because you're uncomfortable talking about suicide, then they might get uncomfortable and not talk openly about it. So ask them directly, point blank, do you ever think about suicide? If they say yes, ask them if they have thought about when they do it. If they say yes, ask them if they have a plan and a means to that plan. If they say yes to all of that, and you ask them if they really intend to do this and they're saying yes, then you know that the situation might be a bit more serious. And I do have in the next slide a crisis plan. So ask them what they might need from you. They might know what they want you to do to help them with these suicidal thoughts. If they don't know, here's some things you can suggest. You can hide their sharps, you can hide their medications or whatever they were thinking about using, help them come up with activities. If they want you to be around them and you think you can do that, make sure not to leave them alone. Do check-in calls with them, make plans with them that they can look forward to, and help them find a mental health professional. If all this is happening and they're not agreeing to keep themselves safe, if they feel like they can't keep themselves safe, you can call, I've included the crisis line for the Austin area. It's 512-472-HELP. You can also call 911, although 911 isn't always prepared as extensively in mental health concerns, but that is an option, and you can also take them to the ER. If they do end up having to go to the emergency room, that can be a really dehumanizing process for people. So see if you can stay with them during that. I mean, I don't know how it looks now with COVID, but if you can be there with them, that will really make it so much better for them. You can bring them clothes, snacks, keep them company. And during, throughout all of this, it's important to be interacting with a mental health professional because this really is beyond your scope. You're there to support them and listen to them. But these topics, definitely, it's important to get professional help. All right, and I'll also quickly talk about how to discuss or how to help your loved ones through panic or anxiety attacks. So for those of you who are unfamiliar with what this is a sudden onset of symptoms like dizziness, fear of losing control, sweating, hot flashes, upset tummy. People might think that they're dying and they might not know why this is happening. It could be out of the blue. And so really important here is not to tell people to calm down or to stop worrying because that would probably make them worry more. And I've included some grounding exercises here that you can do with them. One is breathing. Breathing is really very helpful for people. It helps our fight or flight system sort of calm down and our nervous system come back to earth. And so box breathing is one way to do it. You pick any number like 4 or 5 seconds and you breathe in and hold for 4 seconds, and then you breathe out for 4 seconds, hold for 4 seconds, and you keep that cycle going until somebody feels better. Exercise, movement, stretching, all of that is usually helpful for people. You can do something with the senses, so like ask them to name 5 things that they see, 5 things they can touch, things like that. or ask them to take a warm or cold shower, something that will really bring them back to earth, because they're in their heads, right? So it's important to get them back in touch with their bodies. And if none of these work, it's okay to not to just sit there with them too while they're going through the panic attack. The good news is they usually don't last more than 20-30 minutes. So there is an end in sight, and you can just sit there with them and let them know that they're okay and it's going to be okay. All right, and I'll also quickly touch on what to do if your loved one is dealing with a traumatic situation. So a reaction to a traumatic event could look like anything. It could be a state of shock or numbness, confusion, agitation, nightmares, getting startled easily, sudden changes in eating or sleeping, isolating themselves. So very similar to general mental health concerns. If something traumatic happens to somebody and they're feeling this way for the next few days, we consider that a normal trauma reaction. If it persists for weeks or even months or years, then that's a sign that they might need professional help. So how you can help, again, if you're not a mental health professional, there's things you can do to support them in the moment, but the healing is beneficial when they can do it with a professional talking them through it and processing the trauma. But here's some things you can do. Don't push them to talk about the events unless if they want to talk about it, and help them find resources if they're still in the situation. So if they're living in an unsafe home, helping them find a shelter or helping them find a friend they can stay with. If they need to go to the hospital or the police station, escort them there. Doing enjoyable things with them, respecting their need to be alone. Try not to bring up the event or anything related. So even if this goes for, even if let's say you're in a group and you're all having a conversation and somebody else in the group brings up something related to the trauma, you can really be an ally here and say to that person, hey, maybe let's not talk about this right now. Or you can pull that person away and take them away from the situation. And as they're healing, regular day-to-day things might start to become difficult, like brushing your teeth or getting dressed, making your bed. So celebrate the little things with them. All right, and briefly, I'll also discuss what to tell your loved one about therapy. So there's so many reasons someone might resist therapy. They might feel like they don't have enough time. They may want to deal with it another way. There's so much stigma, especially in the Muslim community, about therapy. They might be shy talking to a stranger or worry that their stuff won't be confidential. So you can let them know that therapy is really, you can design the experience however you want it to go. You don't have to go every week. You can go as often as you want. You can share that therapy is effective. You can normalize help seeking. That's probably the most important thing you can do, is talk about you or people you know that are getting counseling and how it's really helped, and how everybody all across the board when it comes to mental health concerns, and even people without mental health concerns, go to counseling. Remind them therapists are required to maintain confidentiality, and let them know that it's okay to just try it out once. And if you don't like it, you don't have to go back, but it doesn't hurt to just try it once. All right, and this is the last slide that I have. So it can be really emotionally exhausting to hear someone talk about their pain, especially if you care about them, because you really feel it with them. So know your limits. Know that if you're not a mental health professional, and even if you are, if this is your loved one, you don't want to be their mental health professional. So know what you can and can't talk with them about. So you can help and support them, listen to them, but you can't really go in depth with them on the thoughts that they're having, processing things like that, processing traumas. So know where your limits are. Check in with yourself and do some self-care. So really protect yourself. And part of that also is internalizing that you're not the one that's responsible for their struggles. I think that gets really hard, is when somebody you love is dealing with something, you start to feel like it's your fault, or you're the one that needs to fix it. And you don't. It's not your fault. Everyone is responsible for their own emotions, and your job is to support them, not fix it for them. All right, and that's all that I have for everybody. I've included my email address and work phone number if anyone wants to reach out with questions. And yeah, don't hesitate to do that. I also offer free consultations if anyone wants a Muslim therapist. And if not that, I can also help you find a therapist that will be a good fit for you. So don't hesitate to reach out or share my contact info. But thank you, everyone. I think we have time for Q&A now. Is that right?
That's correct. Yes. I think if you can put your questions in the Q&A or the chat, it will go to the panelist. So please type out your questions in the chat, or if you need to talk on the call, just message in the chat and we will open the line for you.
And you're also welcome to email me as well if that feels more comfortable to send questions, if there's any personal questions.
Yeah. While people are probably typing up, I really thought, Najeeha, this was good take-home messages in a lot of ways. I really like how you kind of focused on the fact that sometimes people present with physical symptoms. We see a lot of those, at least 38% by research, people come in, they've done that research in India and said 38% women go with back pain to a primary depression, and that's the most common depression symptom. And also no control with illness. I think that's a very driving point for parents to know that um, you can't control it. The kids can't control it, or the person who has depression can't control it. So asking them to pray, or that can be the answer, and definitely giving them support is the biggest thing in terms of really treatment. I think half of it is sometimes we don't know what to do. Sitting with it is some part of the treatment. So yeah, you do have a question here.
Yes. Okay, couple questions. So someone is asking, how do you encourage someone to go for therapy after they've gone and not liked it? Yeah, that's very common. I would say most of my clients that I have will come in and they'll say, I went to therapy before and I hated it, and I guess I'm trying it again now. And so it's really common to go and not like it the first time you try it. And what's interesting is that research shows that it's not actually the experience level of the therapist that makes a difference. So it doesn't even matter what kind of training your therapist has had. What matters is how well you get along with them. So I would encourage that person that that's normal, and probably they didn't get along with that therapist. And next time when they go to try therapy again, you can do free consultations with a bunch of different therapists and pick which one you actually like more. Like, you can really go shopping for therapists and decide which one works with you and works well for you. And you can also encourage them that this time when you go to talk to your therapist, tell them about all the things you didn't like. Because most therapists want to incorporate your needs into sessions. And so there's, there's great websites like Psychology Today that you can literally filter the kind of therapist you want and look for them, and just encourage them that even, therapy is a process, but even finding the right therapist is also a process. Okay, another question, medication. When is medication best? So I should add that I maybe Dr. Khan is a better person to answer this question because I don't have medical training in medication. So I do know that,
Yeah.
Sorry.
No, I was just saying the way to answer that often for me is functionality. I say start off with therapy, but if your illness is getting to the point that is affecting your functioning, affecting your sleep, affecting your appetite, affecting how you work and things like that, then medication may be an answer to fast forward the process. Healing. That's when I kind of do.
Yeah. And I think a lot of research shows too that medication and therapy pair really well together. So, and it's different for different people too. For some people, therapy might not even work for them because they just have so much going on. Maybe they just have so much anxiety that they need meds to calm them down enough to engage with their therapist. Or it could even be vice versa. Maybe they want to try medication, but they're feeling anxious about that process, so they'll need a therapist to walk them through that. And so it really is different person to person. And so it can be helpful to have someone like a psychiatrist and a therapist collaborating together for what's best for you.
And often when people go to therapy, I often say, give it at least 4 tries. You can't write off a therapist until you've done at least 4 sessions, because sometimes it takes 4 sessions. People on an average do about 20 to 30 sessions. So you have to give it 4 sessions before you can say, I don't like the therapist or I can't work with this therapist. So you got to give it some time before
Yeah.
you connect with.
Mm-hmm.
There's another
Yes.
question here about how do you have a discussion with other people who are part of someone's trauma? Eh,
With other people who are part of your trauma. Oh,
yeah.
so do you mean like these were the people that caused the trauma, or
Unclear, but
okay, yes, caused the trauma. Oh, and how do you start the discussion with Desi parents about getting help and counseling? Yeah, that's a really good question, because there is so much stigma in our communities about counseling. And so that's really difficult. That really is a difficult situation. I think in general, the rule of thumb is if the trauma is still happening and it's something like you're not safe, that person is not a safe person, to get yourself in a safe situation, because safety is most important. And talking about trauma and opening up that door is really, really difficult. So it's important to have a mental health professional with you, talking you through how to do that. I would say speaking, so if it's like the trauma was in the past and the person who caused it to you hasn't done that in a while and you want to approach this with them, speaking in terms that they will understand, speaking in a language they will get. Usually if you start throwing like mental health jargon at people, they don't really get it. And so speaking in a way that they'll understand, protecting yourself so that you're not feeling emotionally dysregulated as you're talking to them, that usually lends to the best kind of conversations, is when you both can be approaching it, kind of what I mentioned in the active listening slide, approaching it in a curious, non-judgmental way, and can really meet each other where you're at. But I also want to note that if someone has caused you the trauma, and you feel like they're going to continue to cause it to you, that's difficult, because like, how do you get this person to stop, and how do you ask for your rights and ask for respect when it's happening to you? So it's really important to take care of yourself, know what you can and can't do, and talk to your therapist.
yeah, no, certainly. I think if I understand the question, the other part I understand is if you perceive the trauma and other people don't see it. Sometimes I get a lot of times parents undermining kids' experiences about something. So, if two people can be involved in a car accident, one can not feel the trauma and the other might feel, and they'll have different versions of it. So I often tell people that I understand if you don't understand that person's trauma, but appreciate the perception and just sort of sit with that. Um, because when you kind of say I'm traumatized and the other person minimizing, it's harder to sort of see it. So I have parents who be like, we were in a car accident, it was nothing, and the kids like, it was really bad. I
Yeah.
often tell parents sit with it, let the kids speak about it. So that, and even with the basic parents about getting help and counseling, I often say, um, depression and anxiety is a medical illness. The sad part is psychiatry is a step sibling to medicine. You don't make so much of money like cardiology does. That's why people do not want to do so much of research. The brain is less understood. And the more we understand, I feel like we'll understand more of the viral loads, immunology with depression, anxiety, why some people have more because they have a genetic deficiency or stuff. So we're far from understanding that. And I often try to tell people that if you have diabetes and hypertension, you would get help. And depression, anxiety is exactly that way. Some people get it, some people don't. We don't understand why somebody gets it and why somebody doesn't. But the answer is still a medical problem. Help. I say start with your primary care physician. Sometimes kind of going to primary care physician, pediatrician, because they may be able to kind of engage in that conversation. And hoping as we kind of expand our Muslim community and have more Muslim providers, uh, we could always start off with Desi people to kind of go to, so that way parents are a little more convinced to come in. Certainly, I do have parents who come in and that's it. This is visit and you gotta fix this. But I guess starting there, getting help and getting professional help is a good way. Getting them to use, and like Najia said, not using medical jargons. Kid walk up to the parents and say, "I'm depressed and I'm anxious," and the parents kind of wash it off by saying, "Hey, you don't even understand what depression is like." So rather saying, "I feel overwhelmed, I feel sad, I can't sleep," would be the words to use, so you can get medical help for those symptoms. Those are my thoughts on that.
Yeah. I hope that answered that question. There's another one that we skipped, I think. So it says, asking about when someone refuses to apply what the therapist taught them, how do you motivate them? I'm assuming, well, maybe I shouldn't assume. If you're talking about a minor, like this is your child and they're not applying what the therapist is teaching them, the good thing is if you're their parents or guardian, you can talk to the therapist about sessions and they don't have to keep that confidential from you. So you can really find out what's going on in therapy. And maybe there's something happening in therapy that's making the kid uncomfortable. Maybe they're not really having their needs met. And I guess really finding out where that resistance is coming from, because it could be that none of the things that they're being taught to apply are helpful. It could be because the behavior that they're trying to change is getting their needs met in a much better way than all the new stuff that they're trying to teach them. So finding out what their needs are that are not being met, and that's where you can talk to the therapist and collaborate. And making sure that you address that situation before you try to force them to apply. Therapy only works well when somebody's actually willing to try those things and being open-minded. So so that was, talking about if the person is a minor. So let's say they're an adult and you don't know what's going on in their therapy sessions. You can help encourage them to talk to their therapist about brainstorming more and coming up with different ways, because maybe what's being suggested isn't working for them. So a lot of therapy is just repeatedly going back to the drawing board and trying new things and trying new things and trying new things. So that's why it can be a long process.
There's another question there. Mine refused to apply what therapist taught her. How can we motivate her?
Yeah. Yes. So I think that is related to the whole like going back to the drawing board and talking to the therapist. If they're a minor, you will be able to get information from the therapist and figuring out what needs aren't being met. So that's usually what the lack of motivation is about, is that there's something that's not being met from these things that's not really helping them. So figuring out what you're missing seems important here. So I would say really, if you have access to the therapist and you're their parents, then figure out what's happening. If I apologize if you're not talking about your child, you might be talking about somebody else in your life, then you obviously can't talk to their therapist. So talk to them and find out what's not working in therapy for them, and encourage them to talk to their counselor about it.
Yeah, and the other part that the therapists give out like 10 or 11 coping strategies, and not all of those coping strategies would work for the kid. And I understand sometimes parents have to pay out of pocket for therapy and they are not getting the change that they want. Like she said, going back to the drawing board and sitting down and concretely making changes, writing down what this change you expect, and then letting the child sort of figure out if reading a book, walking, listening to music, or all of these things are not working for, what would they want? Because I think it kind of goes back to the motivation to get better. Is there the motivation? Because then you will be creative to come up with coping strategies if whatever the therapist is saying is not working for you. So, and then that's where it kind of comes, going back to the drawing board and applying, is this working or not?
Mm-hmm. Yeah, therapy is it's not quick fixes. It's a lot of trying things over and over and over again. So it takes a lot of patience and trust in the process.
Yeah, and I'm speaking about a minor of someone to go to therapy and hesitant to go.
If they're hesitant to go, yeah. So this is a difficult situation to work with, because you can't force somebody to go to therapy. And with therapy, you're really only going to get out of it what you put into it. So let's say that you somehow are able to get them to go into therapy. If they're feeling hesitant or resistant, they may not even get anything out of it. And so, you know, I think here again, it's important to internalize what I mentioned before, that you're not responsible for their mental health distress, although it probably definitely hurts you too. Um, you can't take the blame onto yourself, and they have to be able to seek help when they're ready to do it. So what you can do in the meantime is work on normalizing therapy, talk about, you know, the whole destigmatizing work, talk about how if you're going to therapy, talk about that. If you know people that are going to therapy, talk about that. Let them really know that it's not about being, it's not about something being wrong with you. I see all kinds of people coming into therapy. Some have severe mental illness and some have no mental illness at all, and they just want to bounce ideas off somebody. So let them know that there is no one type of person that seeks out therapy, and see if you can help disseminate more information about it to them. And most importantly here, I think, is taking care of yourself, and just figuring out what you are in control of and what you're not in control of, and drawing that line for yourself is important.
Assalamualaikum. I just want to add a few more things here from the masjid perspective as well. I think we at masjid understand that mental health is actually something that we need to pay attention to, and um, we don't want to stigmatize that and see that it is something that, you know, hey, we don't want to welcome people with mental illness. That's one of the reasons that we have these kind of programs, that we raise awareness in our community. So if we want to have an open discussion, it is not going to be put it under the carpet. We want to address this particular thing, so feel free to reach out to the resources that we have in the community. It is all confidential. Masjid is not going to be part of your interaction with all these superb resources that we have here, Sister Afshan Khan, Sister Najeeha Khan, and others that we are going to get in. So let's leverage what we have in our community. They also understand the religious perspective, where we come from, what our cultural backgrounds are. So that all also adds up. And as far as the masjid accommodating the mental health challenges, we're doing our best that we can. We don't stigmatize anyone coming to the masjid with any illness. We try to connect them with, if we had a couple of incidents that, you know, someone came in and they turn out to be bipolar, and they were good at one time and the other time they will basically make a big ruckus. So for those kind of things, we do need to take protection. We need to keep the people who are coming in safe. What we suggested in that case was a very simple thing, that hey, if you're coming here, come with someone that is your guardian. You know, he may be your friend, he may be someone that can find the immediate contact, because we cannot personally go ahead and address those kind of situations to that person in that state. The only way we can do is find the resources for them that will basically be able to take them away from the harm's way, or basically keep the others from the harm's way. So we basically made out that policy that, you know, someone we know has that kind of a challenge, then we reach out to the family members or someone and let them know upfront that hey, we welcome people coming to the masjid. It's not something that we will restrict or do that, but the only thing is for the safety of others, and this person, he or she has to be accompanied with someone. So we are open. We're not going to put it under the carpet, stigmatize anyone, have an open discussion, and let's work together for a better community, inshallah. Sister Sean.
Yeah, no, Jazakallah, Sister Najeeha. Thank you very much. And we're looking forward to more of those detailed PowerPoint presentation discussions on maybe eating disorder during Ramadan, how to support that, maybe in May before. And then we've got Dr. Ghulam Khan next month, and we'll be sending out an email, inshallah, giving all that information. So, Jazakallah.
Thank you, everyone.
Jazakallah khair, Sister Naji and Sister Afshan. See you inshallah next time. Thank you everyone for attending. Jazakallah khair.